Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some miscellaneous conditions of placenta. One, we have placental infarction. This placental infarction, it is infarction. Okay, that is death of the placenta. This is actually the most common type of placental lesion. This placental infarction is associated with preeclampsia and also lupus anticoagulant. It is associated with preeclampsia and lupus anticoagulant. This placental infarction, it can occur due to the occlusion of decidual artery, and it can cause occlusion of decidual artery, which will cause hemorrhage and abruption in the mother. Okay, the next lesion is something called as battledore placenta. We have something called as battledore placenta. So in this battledore placenta, see, if you see, I'll just draw the normal placenta here. This is the normal placenta, and the placenta is inserted to the umbilical cord at the middle like this. Okay, but in battledore placenta, if you see, this is placenta, this is how the umbilical cord is inserted into the placenta. But here in this battledore placenta, the insertion of placenta mainly occurs at the margin instead of occurring at the center. Okay, so this is called as battledore placenta. It will predispose to increased hemorrhage. Increased risk of maternal hemorrhage can occur due to this. Then we have bilobed placenta. In bilobed placenta, the placenta will have two lobes are seen in the placenta like this. Okay, so this is about the bilobed placenta, right? So thank you guys for watching my lecture. Thank you.
Thank you and thank you for watching.